welcome to Askawayhealth. In today's video, I'm going to be telling you about 3 options in the medical treatment of endometriosis. So, my name is Dr. Sylvia and welcome to Askawayhealth. We're the channel that provides you clarity and direction about everything medical. Don't forget to like this video and subscribe to our channel, but for now, let's get into it. Okay, so if you watched my earlier video where we talked about the factors to consider when choosing the treatment option, and I've linked it up here, I did say that there are medical or conservative and surgical options for the treatment of endometriosis. The aim is to try to get control of the symptoms because at the moment we haven't got a cure for endometriosis. But in this particular video, I'm going to share with you 3 of the different options that are available when you choose the medical alternative for treating endometriosis. The main aim when we're looking at medical treatment is to see how we can control the pain that is associated with endometriosis and slow down the growth of endometriosis tissue or cells within the body. This would also help with bleeding and can help to control some of the other symptoms that are associated with endometriosis. If you want to look at some of the other videos on this particular subject, I have put them up in the link here. We've talked about what endometriosis is and the symptoms of endometriosis, so it might be useful to check on those, and you can watch them before coming to look at this particular video. So the first option in the medical treatment, and this may be surprising for some people, the option is to do nothing. The treatment is to do nothing. This applies to people with a mild or fairly moderate degree of endometriosis, and it's important to say that endometriosis can symptoms happen on a particular spectrum. What that means is on one end of the spectrum you have women that have very mild symptoms of endometriosis, but on the other hand of the spectrum, it's the other end of the extreme where you have women with quite severe symptoms of endometriosis. And the symptoms of endometriosis, like we talked about in an earlier video, can be anything from heavy painful bleeding during the period, bleeding in between the period, bleeding during sexual activity, bleeding during when they're passing urine. They may also have problems getting pregnant. There might be mood problems, anxiety and depression because of the severe impact that these symptoms can constitute on a woman's day-to-day activities and lifestyle. So these symptoms can happen to varying degrees in different women, and therefore you're looking at treatments that can actually control them. So in some women whose symptoms are light, doing nothing might be the preferred method and successful method for treatment. Now, when I say doing nothing, I'd like to qualify that a bit further, because that also includes a natural or lifestyle changes or adaptations that can improve one's health and by so doing improve the symptoms of endometriosis. So this will be looking at things like a healthy lifestyle, incorporating exercise into one's lifestyle, because these are known for women with mild degrees of endometriosis. These can also help in controlling the symptoms. The other natural factors that have been found to help in treating women with mild symptoms are a proper and adequate sleep pattern. Pelvic massage as well has been found to be of benefit. So these are options that a woman who has mild symptoms of endometriosis, or somebody who is particularly young with mild symptoms of endometriosis, can consider for successful control of the symptoms. It's also thought, and there's some evidence to suggest that just simply doing nothing, like I've said, can lead to an easing of the symptoms. So the symptoms could actually go away. But in another significant number of women, the symptoms actually don't improve and they may actually get worse if nothing is done. So again, treatment and care is individual, each woman is different, but it's an option to consider, like I said, for women who have mild symptoms of endometriosis. The second medical treatment that we have available is the use of painkillers, pain medicine. So in women with a moderate degree of symptoms that include having heavy and painful bleeding, it may be that what they should be on is a course of pain medication, for example paracetamol or ibuprofen and naproxen medication that they can use to control the pain, particularly during their menstrual period or pain that happens in between the period. This may be all that's required in such such category of women to control the symptoms. They may not particularly have issues with constipation, they may not have issues with losing very heavy amounts of blood or painful sex or intercourse. And if that's the case, in that category of women, simple pain medicine might be all that is required. Of course, like we've talked about, women having different degrees of the condition. Some may need stronger painkillers than others, and for women who may need stronger painkillers, of course, that's having a discussion with their doctors to get a prescription for these medicines if they're not prescribed or available for the counter. But we do know that a lot of the time, heavy pain or severe pain is associated with heavy bleeding. So usually, if you're going to have to tackle a painful period that's also associated with heavy bleeding, it may be that the painkillers are not sufficient, and so you need to go down another route to look at how to manage this particular category of women with these symptoms. And this brings us to the third type of treatment option that we're going to look at today for medical treatments of endometriosis, which is hormone therapy. And because these are medications that amend the way that the womb tissue, the inner lining of the womb, actually respond and could control some of these effects, and particularly we're looking at heavy bleeding symptoms. So what these hormones do, particularly to limit the action and curtail the effect of estrogen in the body on the womb, because we know that it is estrogen that promotes the growth of the womb tissue, and so will promote the development and the growth of endometriosis tissue. So if you're successful in finding something that can control the effect of estrogen, then you're likely going to be successful in controlling the heavy bleeding that's associated with endometriosis in this group of women. What are hormones? Hormones are chemical components or chemical substances that control and influence certain activities within the body. I have another video coming up on hormones, what they are and how they work, so I'd really recommend that you check out that video. It's quite useful. But going back to our topic, we're speaking specifically on hormones that are going to work on the tissues of the womb. But going back to our video, we're going to be talking about hormones that work on specific tissues, in this case the womb. In the reproductive system for women, two of the primary hormones are known as estrogen and progesterone. These hormones are produced by the ovary. Their activities are controlled by the brain, and it's important to consider their effect and how they can be used and how controlling them can improve symptoms of endometriosis. So currently, the best way of limiting or controlling the effect of estrogen on the womb's tissues and reducing the growth of endometriosis tissue is by using hormone-containing medication, and we're going to look at two particular groups today. The first group is the combined oral contraceptive. So what are combined oral contraceptives? These are medications that usually contain a combination of estrogen and progesterone, which are usually used for the prevention of unplanned pregnancy. So when a woman takes a combined oral contraceptive, it withholds the production of natural estrogen from the woman's ovary directed by the brain, and by so doing it leads to a less intense pain, makes the period bleeding lighter, and tackles directly those two major symptom points that are quite common in women that suffer from endometriosis. So what the combined pill or the combined oral contraceptive will do is create an artificial period that is different from the woman's natural menstrual period on a month-by-month basis, but it creates an artificial period which allows control of the amount of estrogen that the woman's womb is subjected to, and this quantity of estrogen and progesterone will reduce the amount of bleeding the woman experiences during her cycle, and reduce the amount of pain that the woman also experiences. So for a woman who suffers from heavy painful bleeding and who is at a stage where she is not looking to have children, not looking to get pregnant, it may be that the combined oral contraceptive can be considered if it's suitable for her, taking into account possible side effects, age, taking into account her preference, the combined oral contraceptive might be a suitable option for women in that category. Okay, the second method, hormonal method for controlling the endometriosis symptoms, is a method that contains the other female reproductive hormone, which is progesterone. And progesterone can be given or taken in a number of different forms. One of them is the progesterone only pill, which is the mini pill that is also used for preventing unplanned pregnancy or family planning. The other method that women can take progesterone is by the progesterone injection, again used in family planning, or the implant, which contains progesterone. Women can also receive progesterone in the intrauterine device or coil that contains progesterone. And lastly, there are progesterone containing medications that are not the mini pill. They have different concentration of progesterone with them, so they're not used to control or to prevent pregnancy, but they do contain progesterone that can be used for treating endometriosis. So you've got the range of different options, and the beauty of that is that it allows you to offer a woman a choice that will be suitable for her, satisfactory for her in the way she can use it, and also helps to control the amount of estrogen, because again, that's the aim. You're trying to control the amount of estrogen that's being produced naturally, which it stimulates and increases the endometriosis tissues to grow. So you can succeed by doing that by using any of these progesterone containing methods that I have described. So the progesterone works by controlling the development of the womb lining and reducing the growth of the endometriosis tissue. And if you remember, the target or the purpose of this was to make sure that we control symptoms, not just pain, but also bleeding, which can go hand in hand sometimes in women with endometriosis. So that's how you can use hormones, those that either contain both a combination of progesterone and estrogen, or just the one that contains progesterone. That's how you can use them to control endometriosis symptoms. But I think it's important to say that, well, not every woman can or will take hormones from choice, because they don't want to have hormones, or because they cannot tolerate the hormones, they develop side effects, or if a woman is trying to get pregnant, she is not going to have these hormones, and I wouldn't be offering that particular option to her, because obviously these medications are developed to prevent pregnancy, so there has to be some other option for that particular category of women. But in the case of women who are not in that category, these can be very useful options for treating or limiting the intensity of the endometriosis symptoms, particularly when it comes to painful, heavy bleeding. So that concludes our look at the medical treatment options for endometriosis. We've said the first one we talked about, do nothing, which technically means not taking any medication, but it looks at the natural process, lifestyle measures, lifestyle changes that could help, particularly useful in women who have light symptoms of endometriosis. And the second option, we looked at pain medication, painkillers, depending on the degree of pain. If it's not too severe, over-the-counter medications like paracetamol or ibuprofen might be effective for that group of women. And lastly, we looked at hormone-containing methods. We talked about which group of women will find this most useful, and which women may not find hormone treatments useful. So in the next video, we're going to be looking at the surgical treatments available and have a closer look at which group of women this will be more suitable for. So thank you for listening. I appreciate your time with me today. If you've got any questions, feel free to send them in through to us. I'm going to put all our contact details in the description link at the bottom of the video. I hope you've enjoyed listening and you found it useful. Please like the video, share with your friends or family. Consider subscribing to our channel as well. Finally, I'm Dr. Sylvia again, and this is Askawayhealth, where we provide you with clarity and direction about everything medical. I look forward to seeing you in my next